18 years ago, China was battling SARS. It took 2 years for Beijing to completely defeat the epidemic. But by then, the disease had spread to 26 countries. SARS infected more than 8,000 people and killed nearly 800. Is history repeating itself with this coronavirus? We hope not, but the signs are not encouraging. The number of patients has more than doubled already. The new coronavirus has triggered panic not just in Asia but around the world. There's a fear that China underplayed the seriousness of this outbreak. The authorities are suspected of a cover-up. On WION Edit tonight, we'll assess China's handling of this crisis so far. First, some numbers for you to consider. According to one report, there is one general practitioner for every 6,666 Chinese citizens. One. Another estimate paints a picture that is far worse. One general practitioner, one doctor, per 7,200 people in China. As many as 650 million Chinese were without access to a GP, general practitioner, in 2017. China's healthcare system is broken. China might have a strong economy, but Chinese citizens are struggling to get even basic health care. They do not have universal health coverage. Household incomes might have gone up in China, but Chinese citizens end up paying through their nose for health care. Plus, as we said, the timing is tough. This is peak travel season in China. 3 billion people, 3 billion, will travel across the country for the Lunar New Year. Wuhan is a city of 11 million people and a regional travel hub. The government seems unprepared or unwilling to share how far this virus has spread. Researchers in Imperial College of London say that more than 1,700 people could have been infected. Chinese authorities confirm only a fraction of this figure. With the fears of a cover-up mounting, Beijing had to intervene. And this is very interesting. Chinese President Xi Jinping issued explicit instructions. The government has asked its officials to share all available information. Beijing has issued a firm directive. It has warned party officials that anyone caught withholding information will be, quote-unquote, nailed on the pillar of shame for eternity. Extremely dramatic. The fact that the government had to tell officials to not hide information shows that there is a tendency to do so. It puts a question mark on China's handling of such situations. They're clearly scrambling to contain the outbreak. In what's being called a PR stunt, Beijing has appointed Dr. Zhong Nashan, the same doctor who led the fight against SARS 18 years ago. He will be the man to devise a way to deal with this crisis. We believe the number of patients will go up in the days ahead. The disease might even spread to other regions and continents, which brings us to the issue of global preparedness. How prepared are we here in India and elsewhere in the world for such virus outbreaks? The answer is not very much. In the decade gone by, we've seen several major outbreaks: bird flu, Ebola, the Zika virus. Asia in particular has struggled to combat health emergencies. Here in India, dealing with a dengue outbreak has become an annual affair. Most global health systems might respond to a crisis, but science has taught us, as is experience, that prevention is better than cure. The developing world needs to step up infection preparation. Experts at the World Health Organization recommend that disease surveillance systems must be strengthened at the local level. Cases of zoonotic diseases are diseases transmitted from animals to humans. Such cases are growing. Animal and human health sectors should then collaborate to tackle this growing threat. And for the challenge that's in front of us, the WHO must consider declaring this outbreak in China as an international public health emergency. And then there should be a coordinated global response. China also stands to benefit from this. This outbreak must be stopped in its tracks, otherwise the world will be staring at a much bigger crisis.